I'm inviting Dr. Winkle Deva to begin the session.
Yes, good evening, sir. Good evening, everyone. A very warm welcome to all the respected doctors, teachers, students, practitioners, and participants who have joined us for yet another enriching academic session of the International Forum for Promoting Homeopathy IFPH. Today is a very special day as we continue this remarkable journey of the uninterrupted daily webinars. It is my privilege and honor to welcome you all the 2182nd day of the IFPH uninterrupted daily webinar being held today 22nd August and 2026. I hope everyone is ready for the another insightful evening of learning, clinical reasoning and professional exchange. So, for those who are joining us anew, the International Forum for Promoting Homeopathy or IFPH is an international humanitarian organization dedication to promoting the homeopathy across the globe. IFPH brings together homeopathic movements, activities, practitioners, teachers, and students under the one umbrella beyond the regional, religious, political, and ideological differences with a common focus is on the advancement and promotion of the homeopathy. And now it is my great pleasure to introduce our distinguished speaker for today's session. We are honored to have with us Dr. P Nidheesh sir, MD Homeopathy and esteemed physician and experienced homeopathic practitioner. Dr. Nidheesh has been practicing as a physician since 2011 and the CEO of New Life Homeopathic Clinic at Thrissur. He has also served as a medical officer under the Ayush mission, bringing valuable experience from both clinical practice and public health care. He is also an accomplished author and he has authored the Hidden Protocol, the Father and Archetype Modulation Therapy. Dr. Nidhesh is also the founder of the Archetype Modulation Therapy, reflecting his continued efforts towards the exploring structured approaches in clinical understanding and therapeutic practice. Today's session is particularly interesting because we are continuing an important academic series. The topic for today's webinar is a structured approach to clinical reasoning in homeopathy, part 3. Clinical reasoning is one of the most important skills in the medical practice. It allows a physician to move systematically from the patient's presentation to understanding the case, identifying the relevant clinical information, analyzing the available data, and ultimately arriving at a rational therapeutic decision. I am sure that today's session will provide us the valuable insights into the how we can make our clinical thinking more structured, more logical, more systematic, and more practical. So, without taking much of your valuable time, it is my privilege to invite our respected speaker, Dr. P. Nidheesh sir, to take us through the today's session. Sir, we are delighted to have with you us. Over to you, Doctor Sir.
Thank you. And am I audible?
Yes.
Yes, sir.
Okay. So once again, my sincere thanks to IFPH for inviting me to this platform and share what I perceive about homeopathy. So today is the third session, which is the continuation of the past two sessions. So before going to the sessions, the past session we had some question answers at the last end, where some doctors had many doubts. So I will start from there. Why at this time the concept of standardized homeopathy is important? Say I'm working, so today I'm not producing any slides today. Today I will be uh, explaining as such. So what is the importance of standardized homeopathy? Last time I have already given the answer, but this time there are some more new guests here. So the purpose of standardized homeopathy is that every homeopath, those who are practicing the system, must have a their framework where they can work together. We all know in today's circumstances, if a patient is consulting one homeopath, suppose if he is from Mumbai, if he is consulting a homeopath in Mumbai, and if he relocated to Tamil Nadu, if he was not able to communicate with his old doctor, he has a new doctor. But the methodology of two doctors will be entirely different. So sometimes in the case in the Bombay, the doctor may have taken his case, may have understood the patient perfectly, and may have given the treatment what is required to him. But when he reaches the Tamil Nadu, sometimes the doctor fails to understand the case, sometimes can give the medicines, which can even cause the hampering of the case. So this is one of the issues that is faced by many of the homeopathy doctors, especially in those who are staying in the metro areas. And second issue that I have listed last time is about the legal thing. As we all know, the homeopathic doctors' medicines are effective in both acute and chronic conditions, even in emergency cases also. So for those doctors who are taking the emergency case or acute cases, sometimes some mishappen can occur during our treatment. So if that mishappen occurred and if we are not able to substantiate our point, it is also going to become other medical legal issues. So to prevent from that medical legal issues also, we have to be backed by homeopathic experts. So the problem with homeopathy is that whenever we give a medicine to a patient, if the disease is coming down or if it is progressing, we will think that the medicine can be right. And if the patient is not responding to the patient, we will tell that the medicine is wrong. This concept is the basic problem with homeopathy. Why? Because in the beginning stages of my practice, I was working in a government sector. So that's a still remember a case. It was a case of fever of a child, and as we treat the patient, we will give some medicines to the patient, and the fever was not coming down. Nearly it went for 4 to 5 days, and I changed the medicines frequent also, because it is my starting practice, and it may be within my 3 or 4 months of practice starting, and I was changing the medicines frequently, but there was no result at that time. And day 4 arrived, the patient is still with me. The case is not yet gone from me. So I just called my father. He's also a doctor. He's also here, Dr. Radhakrishnan. I called him and asked him that the case is there, and I have given so much remedies, and even then the case is not responding to my treatment. So what should I do? The reply he given was that, first of all, you stop giving the medicines and just wait, and you prescribe the medicines which you give the first time. Very beginning of the treatment, whatever medicine you have given, that will be the exact remedy for the case. So I stopped all the medicines. I just gave, he asked me to just just give 1 dose of CPI 200 to neutralize the potencies. And after that, I just started like the medicine which I gave the beginning. Miraculously, within next 12 hours, the whole episode of fever came down. So from that moment onwards, I have seen something that the first remedy which we select after seeing a patient, for getting it wrong, the chance is very less. Because first time when we are seeing a patient, we are observing the patient first time. So we are taking the case in detail, we are observing his symptoms, everything. So whatever medicine we take, give to the patient will be exactly right. So it was not the problem with the medicines I selected. The medicines that was right, but the patient was not responding. The problem was that I was not waiting till the time the medicine was working. So again, the question comes here. So some juniors calls and tells, I gave the bryonia to the patient. The case is not responding to me. Whether the bryonia is wrong, we can tell. Whether we should wait, we can tell. So what I'm telling is that if a medicine is not working, does not mean the medicine is wrong. The medicine can be right. It may require some intercurrent. It may require some more time. It may require sometimes the medicine is right. But something is there which is obstructing the medicine to act upon that specific individual. It can be the disease pathology itself, or it can be the medicine potency or some other things. So, to make these things established, we thought of how to standardize homeopathy that I told last week. So in today's session, I will be continuing the same scenario with different levels and approach to patients on different levels. Last the major questions came was, one of the questions came was how to taper the dose if it is a level 1 case, level 4 case, level 6 case, etc. Today, I will tell you what is the beauty of this system without interfering with the methodology you practice right now. Say today, each and every doctor has their own methodology. They have their own method of treating the patients. Sometimes they may be taking the totality of the symptoms and prescribing the exact similar remedy in millismol potency or in centismol potency, sometimes in the jar method, or sometimes some patients will be going in with the pathological prescriptions or some keyword prescriptions. So there are nearly 10 to 12 types of prescription homeopathy. So which type of prescription should be adopted to the patient before you? That is the question I want to answer using this tool. I'm not here to answer what medicine you should give to the patient before you. Example, if a patient coming to you with pneumonia, I'm not going to tell you that you have to start with aconite. I'm not going to tell you that you have to start with bryonia. I'm here going to tell you how can we fix the plan of treatment based upon the case before us. How we can know the patient before us needs a miasmatic medicine? That is the beauty of the system which we have evolved. And this is, I wrote this whole concept and compiled with my father in 2019 or 2018, at last period. Before COVID, it is done actually. And it is presented in LMHA conference at UK, which was conducted 2020. It was presented as a paper at that presentation. And after that, it is trialed and tested by many of my colleagues. So now I will explain to you what are these levels exactly and how these things resonate with the doctors and how we can reason homeopathy. We can tell, say, reasoning with the part of homeopathy, that is very much interesting. When a patient comes to a homeopath with a migraine, and he takes the whole case and find out his constitutional remedies, sometimes sepia, some take sepia. Given him sepia 200 or potency, treated for nearly 3 months or 5 months, 6 months. And he got very good result. And the patient is asking back to him, Doctor, your medicine worked well. How did the medicine work? What happened to me? What was this thing that was missing in me? And what is the thing I have to do? So these questions, when the doctors answers, many are giving different answers. Some doctor will tell, I have taken your holistic approach, and based upon the holistic approach, I'm coming to a remedy in the homeopathy, which is also holistic. And that medicine, when I give it to you, will correct your body in a holistic manner, and you got correct. This is the one explanation. Some doctors are going for spirituality, dynamicity, different reasons for each homeopath for curing the disease. That is second most important part. First is the medicine. What medicine is wrong? Disease is not responding, medicine is wrong. Second is reasoning part. The reasoning given by the doctors, even if the disease is cured, even if the disease is relieved, or even if the disease is aggravated, differs from individual to individual based upon the knowledge and perception of each doctor. The standardization of homeopathy must work in reasoning of homeopathy. The clinical reasoning is the part where we have to work to make the homeopathy system standardized. At the same time, we must not discard whatever knowledge is there till date. Because We have got many knowledge from Dr. Kent, Dr. Bonnie Hosen, Dr. Clark, and now we can go with Dr. Vidolkas, Dr. Rajesh Shankaran, and Dr. Professor Vijay. We have got enormous knowledge to our system. But how can we incorporate all this knowledge system without disturbing the individualization of homeopathy? That was the question that was before me, before launching something called standardized people. So the first question that I went through with myself is that a patient is coming to our clinic. He may need a medicine which is symptomatic. He may need an anti-miasmatic medicine. Sometimes he may need a full constitutional medicine, or sometimes he may need a palliation. What is the basis of prescription? What is the basis? So I didn't look outside. I just observed my father because he's practicing for the past 50 years, treating from small disease to even cancers from his childhood. So with great results. So I was observing him. What is the thing? How his prescription differs? Some he's giving some blind prescriptions. Some he is taking time and giving some other prescriptions. So what is the basic thing that is affecting all these prescriptions in a common? And I just remember my college days also where I studied. The different doctors also using some methodology. And what is it? What is the common thing in all these aspects? And with my practice, and with my colleagues' practice, and with my friends, everything I was just trying to observe the pattern that is common in homeopathy. And based upon that, I came to a conclusion that homeopathy treats the individual, not the disease, as we all know. So, who is an individual? So, individual is a person who is healthy. Is healthy. So, if he become unhealthy, we are giving medicines and restoring him to healthy state. Okay. So, we have to address his health status as well as disease status. By only looking to his health status, we can't tell he is fine. Suppose if his all physical generals are normal, he's when you encountered his case, his mental picture is also not so much problems. And the history part also, there is not much issues. Does that mean the disease is not there? No. Even if the patient is coming to you with all the generals normal, with the history is also not so problem, he can also have some other issues with him. So, I dig deeper and I found out that if we can balance both, like in a balance, if one part is health and if I put other part as a disease, if health can, if the patient's innate health is more than the disease he has, his body has a curable, his body disease is curable without medicine. Why? Because his body's vitality is very strong. So how do we measure this vitality? And for homeopaths, it's very good, very easy to measure vitality because we have our own physical generals, mental generals, and history. History means family history, past history, treatment history. So if we look at the history part, physical general part, and mental general part, we can get the vitality of the patient. So that gives the vitality part, first part. So second comes the disease part. So what are the part that comes for disease? So as we all know, first is the intensity of the disease. The intensity of the disease is the one which determines the disease acute or chronic, right? So this intensity. And second thing is the duration. Say, if I have asthma for 1 year, I have asthma for 5 years, I have asthma for 10 years, the picture differs. We don't see a patient who has asthma for 1 year, same as a patient who has asthma for 10 years. So, duration is a most important part. And a third important part is the pathology of the disease. How much invasive this disease has gone. Suppose if patient has bronchial asthma like symptoms, And on CT scan, you have found out that there is some disturbance in his alveoli, or there is emphysematous changes started. And similar, another patient with bronchial asthma, CT scan reports is not much problems. There is only spasmodic things only. There is functional changes only. The treatment differs. So that's the third is the pathological part. And fourth is the extent. So extent, when we take in homeopathy, we all know that, say a patient is coming for us for same, you take with the respiratory system. Along with that bronchial asthma, he also develops some other problems like kidney stones or osteoarthritis, uric acid diathesis. That shows that he has some more diseases also. So the extent of the disease, according to homeopathy, we don't name the disease. We tell the patient is sick. So what happens is that if I am having a disease X, that disease X is causing disease in me. For example, there was a case of diabetes which came to me 6 or 7 years before, and her sugar level, she is very lean, and her sugar level was nearly 350 something, and she does not want to take allopathic medicines. And I just asked her to take her GTT, glucose tolerance test. And after that glucose tolerance test, what happened was that after 2 hours, the sugar level climbed to 620. And her insulin level was also not less, so less, but it was less. And it is not type 1 diabetes, it is type 2 diabetes with insulin resistance as well as diminished insulin production. So in that case, when I took the case and I found that this, before starting of the diabetes, she had removed her uterus for fibroids. And after removal of the uterus for fibroids, then only this complaint of diabetes started. And when I was studying in the college, one of the professors has told me that there's a pattern where some patients uterus has been removed because of fibroids. That disease can go to pancreas and can cause diabetes. For that condition, the best remedy is Berberis vulgaris. And I don't know whether you believe it or not, that Berberis vulgaris worked like miracle. And within 1 year, that sugar level came down to hundreds. That is not normal. That is 160, 170, 140 area. From that 600, it come back within 1 year without an allopathic medicine. So in homeopathy, there is no disease. It is only sick individual. So the patient has a complaint, and from that complaint, these all things spreads. So the extent, if I have uric acid diathesis, if I have lung complaint, I have gastritis, these all are expression of the same disease in different areas. So extent is also very much important. And the last point is that the nature of the disease. The nature of the disease is that whether disease is self-limiting or not. So what is self-limiting disease? I have defined self-limiting diseases as those diseases which disappears in an individual without any type of intervention, either therapeutic or change in lifestyle. If I have a pain in my legs, and if I just take rest for 2 days, it went off. That's self-limiting disease. But if I have a pain in my legs, I use my bandage to correct my posture. Then I just use some oils to correct that thing. My pain is gone. Second one is not self-limiting. Second one it is not self-limiting, but it required some type of intervention. Without intervention, it won't get cured. So this is the classification which I have made for self-limiting as well as not self-limiting. And whether the disease is self-limiting, is there any complications? Or what is the stage of that disease? If I have diabetes with diabetic ulcer, diabetes with cardiac complications, what is the stage that is right now? So based upon these 5 parameters, I defined the disease intensity in that individual. So in the balance, one part I put the health, in the second part we put the disease, and we will see which part is stronger, whether the health part or the disease part. If the health part, the cure is more spontaneous. And if the disease part, the cure is non-spontaneous. So based upon this, the whole idea of standardization of homeopathy, the hidden protocol, the book Hidden Protocol is published in 2024 or 23. I don't remember the exact date, and it is available in Amazon, Flipkart, and all over the world. It is available in the global market. It is available, and this hidden protocol is basically converting our case record into a questionnaire where all these marks are being taken, and based upon the total score, we will fix which type of treatment is required for the individual. So the levels 5 does not mean the disease is very high. Level 5 means the disease is all can be very high or the health is very low. So based upon both parameters, these levels are, this score system is working. Not only based upon disease, but also based upon the health part of the individual. So coming to the first point. So the level 1 patient means his vitality will be stronger and disease will not be so much advanced. So symptomatic treatment alone will do. So the doctors can take the case, see the symptoms, take the complete symptom and prescribe the medicine. That's done. You can go with any type of prescriptions based upon these symptoms. The level 2 vitality may be weak or strong. Disease may have improved, maybe little more or same. But if it is level 2, the disease is starting to get some establishing in some locality. That is, localization we have starts in level 2. And when the level 2 comes to the level 3, our latent sora, which was sleeping, will become active, and it will be the one which will be running the whole show. For level 3 to level 6, that will be the one who will running the whole show. After this level 3, the pathology is still maybe high, but at the level 4, definitely we have to go with frequent test. Otherwise, it can go for more complications. Even surgery may be required in the level 4. The level 5, we have, that is the place where true homeopathic doctors excels. I have seen the cases in level 5 getting miraculous result. Why? Because that's a place only homeopathic doctors can treat. All the systems can treat up to level 4. Level 5 is our highlight, homeopathic doctors highlight, where we have to take the full case along with the constitutional medicine and give the medicine in the prescribed format. That's the only place we need exact full constitutional medicine. Other places we can go with any type of therapy. That is why all doctors are getting results in almost all areas, because level 5 cases are not so common, and that won't come to homeopathy also. When the level 5 is also over, it is going for palliation. At that point, we can't improve the quality of the life, quantity of the life, but only quality of life. There you can give them medicines based upon the symptoms of the patient and give some constitutional medicine also in the low potency to make the patient suffer less. And this is the whole idea of the standardization of homeopathy, so that a doctor, even if she is a beginner or even if he is a veteran homeopathic doctor, can choose this system and see which level the patient is in and give the prescription based upon that. This is not the ultimate system or something. What I want is the scientific rigor in the homeopathic fraternity. We all are running behind to find out what is the molecule inside the drug and how it works. Let the physicist do that thing. Our purpose is to just show this medicine works repeatedly, and it can be tested and trained by anyone in the world with our own research methods. The problem with homeopathy is that we are adopting the research methodology proposed by the science today. the randomized control trial like test is not suited for homeopathy. You can take the randomized control trial test, but the randomization must be based upon the categorization. Because that is what I told you. Because I am getting a randomized patient of 20 cases, each falls in different levels. How can we do that thing? We can't standardize it, right? So randomization is a method we can use, but not in constitutional homeopathy or in individualized homeopathy. Many studies has done with that name, but when we go deep into the research, we can see that that is not right, because there will be a point where randomization fails. So first we have to establish ourselves with a clinical reasoning part, what I am doing to this patient, why I selected this medicine. And when I select this medicine, what happened to that individual? These answers must be given to the patient by the doctor. For that purpose, doctor must know what exactly happened to the patient when I give the medicine to him. So this is the part where I am getting much insights from my father, and he's here today. So if we have time of 5 or 10 minutes, I can ask him to speak upon this specific matter. That is, whenever we give, what happens to the patient when we give medicine. So he will tell some of his insights. That will be helpful for you. And if it is okay for the host, then we can move like that. Otherwise,
Yes,
we can go with
yes,
Q&A.
yes, we can have session. Yes, sir, please open the video.
I will introduce him. He's my father, Dr. P Radhakrishnan. He's a retired chief medical officer. And more than that, I took homeopathy only because I have seen the cases he has treated, especially the medical emergency cases. He has treated like severe epistaxis, stopped within 1 hour with homeopathic medicines. So that type of medical miracles. And when I was studying, there's a case of epilepsy came to the clinic. Patient felt in the clinic in front waiting for the medicine, and he done it within what I can tell 1 or 2 minutes. That was okay. So these cases made me came to homeopathy, and now I ask him to give some insights for what I have done.
Yes, sir. Yes, sir. Welcome, sir.
Okay, I am Dr. Arshan. You continue for only after getting the, if any doubt, only after clearing the doubt, I can just continue. That's best. If any doubt till now, you just ask me, and after that I shall continue.
Okay.
You ask about.
Okay. Dr. Daniel sir, can we go for Q&A or should I have to continue?
Yes,
Because last time we don't get the time to Q&A, that's why I'm asking you.
yes, I think only very few. Yes, somebody has raised. Yes, Dr. Karna, we can go ahead with the question answer session. And if
Okay.
we get some time, then we can go. Yes, Dr. Karna, you can. And please unmute yourself.
Good evening, sir. You are explaining very nice about standardization of research methodology. But
Okay.
I have a doubt. Our research has done by our homeopathic people only. What allopathic mode of speak, they have taken one drug for certain diseases like that. In our homeopathy is also like that. One drug you have to choose on. How many conditions are resolved by using this drug? Or if you have take one type of disease conditions, how many remedies are indicated specifically on the basis of totality? Why you should not conduct like that research work and standardly publish in this disease condition? These are the remedies are more worthful, or this is the remedy works in so many. Repertory has given one idea, different subrubric. Why you have to recommend such a type of standardization research work in homeopathy, sir?
Doctor, it's a very good question. The problem is that homeopaths won't accept that thing. That's a problem, sir. Why? Because if I am telling you, say we all know that if say take a medicine called sanguinaria. As we all know, sanguinaria is a very good medicine for sinusitis. You take for sanguinaria for sinusitis. We all know that right-sided sinusitis, we can get a very good result by sanguinary candidiasis. And you do research and you are getting that out of 100 patients, 70 to 75 patients got result by sanguinary candidiasis in 3x potency or 30 potency, whatever may be the result. But when this result comes out, I will tell you, sir, you will be challenged by homeopaths itself, telling that this is not homeopathy. They will be telling that homeopathy is something different. For homeopathy, you cannot tell this remedy is for this disease. You have to take the whole case and give the constitutional medicine to the patient. Then only the cure will occur. Otherwise, you have suppressed the disease. That will be the statement by the most of the doctors. So that is why I'm telling you before going that point where this methodology which I introduced came. Why? Because if it is a level 2 case, you are proposing that the title can be a study on effectiveness of sanguinary candidiasis on acute sinusitis in level 2 hidden protocol patients. If you put like that, that is different. That can work. But if you tell that to all the patients, that will cause some issues with the homeopathic fraternity. That's the only point that is issue there, sir. Hello? I think I made it clear.
Yeah, sir.
Dr.
Okay. What you said is right, sir. No problem at all. But whatever the potency, it shows some effect, on this disease. Na, it is more worthful, or in certain cases, so and so potencies are more worthful, or lower potencies are good in certain cases, higher potencies are good in certain cases, middle potencies are. There is a fixed guidelines are there. Now you have to done. We are a little bit justified to that. Whatever.
Yeah, doctor. For that purpose also, doctor, whatever you told is right. When we go through the prescriber of Dr. Clark, you can see he has given only low potency medicines and tinctures in that book, right? And Clark was an allopathic doctor, and he who wrote extensive practical material medica. And we can't tell he does not have knowledge. And the prescription he have, if we have only for prescriber from the time Clark has put forward, now homeopathy will become the top system in the world. Why? Because it has given clearly how to treat. And more medicines will come under it. But that type of treatment does not cover homeopathy fully. Because if a patient has a sinusitis complaint, if the case comes in level 4 or level 5, what we see as sinusitis may not be a sinusitis. It can be a general vitality problem where we should prescribe a constitutional medicine to the patient with only there can be a cure. So the problem with the homeopathic prescription giving to a patient based upon the disease is that the patient must fall either on level 1 or in level 2. Even if it is moved to level 3 also, we have to prescribe an antisoric medicine. Without prescribing an antisoric medicine, I am telling antisoric because suppressed gonorrhea and suppressed syphilis are not so common in today's days. That's why I'm telling antisoric, Hahnemann antisoric, not the GNID, non-modern medicine, modern miasmatic, Hahnemann. That's what I am telling you.
Yeah, okay, sir. Thank you. Thank you.
Okay.
Is anybody
Okay,
has
is there
doubt?
anybody
Please
now
raise your
to
question.
understand something?
Vipul Prasad Pandit sir. Yes, Pandit sir. Sir was the former principal of Rajkot Medical College. Vipul. Yes.
Okay.
Yes, sir. Yes, sir. Sorry, sir. Unmuted.
Okay. So
Okay, yeah. Today our subjects, the clinical reason. That is what he said now. Because he's used this use of this hidden protocol. Audible, am I audible?
yes.
Okay, that means there are enough doubts, especially each and every homeopath travels in different ways. But each and every homeopath's aim is one, to find out the simillimum. This is the way to understand. But in which cases the simillimum is enough? or whatever be the other system. Otherwise, the allopathy, homeopathy, other systems of medicines are there. Therefore, what is the importance of homeopathy in treating in the patients? That is the thing that which we have to understand. For example, suppose there are a lot of patients who are coming to us and to allopaths, Ayurveda, and all doctors. But there are certain cases which are very much effective under homeopathy. That's because the importance of this similimum, the selection of similimum. But the selection of similimum, which comes under the fifth level as per this hidden protocol. That's why, without needing this, needing this hidden protocol, fifth level, the patient who comes to the level 1 or level 2, we are searching for similimum. I think that there is no need of such. Why? Because there are certain cases which is only having the symptoms, a simple case. In that case, there is no need of inquiry like that. And in the level 2, no more like that, because little pathology will come. Level 3, the myasm. Up to level 3, there is no need of the search of similimum. We are wasting enough time to find out the similimum. Means the total. Most of the doctors we are getting, the patients who comes to us, we are using or we are collecting the symptoms. Only after that, we are taking the maximum myasm, temperament, etc., we are noting and we are prescribing a drug. That's what we are doing. But whenever that pathology is being advanced, the more lab investigations or any other techniques may be needed. Before means to understand the status of the tissue destruction. While we are understanding the tissue destruction, we can proceed accordingly. Then for that purpose, the level 4th come. Therefore, each and every homeopath who practice never wait upon up to 3. But we have to go up to 4, 5th, 6th. But each and every homeopath must learn the pathophysiology, that means anatomy, physiology, means other allied subjects we must be solved. Because the human body means not only the system base or the organ, but its functioning. Definitely, we are having a nervous system, that is brain, that is the mind and body. The mind mental symptoms we are giving importance means the brain chemistry has been going on. That is, there are variations. For example, there are enough happy hormones are there, stress hormones are there. However, a patient who stress upon that such and such a situation, for example, those who stress over this grief, or in the vexation, or in the disappointment, or in the sad occasion, definitely the brain chemistry also vary. According to the mental exhibitions will also variance. Therefore, we have to analyze the person mental symptom. We are understanding only the mental symptoms from the rubrics instead of those who understand the stress pattern of such patients. That means the emotional aspects of the person. When, if suppose in an emotion of sadness, sad occasion, the happy occasion, definitely it exceeds to certain limits. That may cause some variations in the nervous system, whereby, or the endocrine system, whereby the hormone levels, difference in hormone levels, definitely they will make a category. Therefore, we must be familiar with almost all pathological conditions that which are related to each and every organ. Those who understand or those who know all these things, they can join together and they can understand what is the importance of the mental rubrics or mental symptoms we are selecting a drug. Therefore, our selection or the symptoms recorded in the materia medica, definitely it is clear. But we are unaware about it, how we can explain? That is the question now. In order to explain such situation, we must know all these things. Then only we will be able to treat such cases. Are you clear now? Can you understand?
Sir,
Is
yes,
there
sir.
any? Okay. But this is the way of approach. Whenever a patient comes to you, you are taking the symptoms from the patient. At the same time, we are searching that his character, his temperament and everything we can understand by the mere seat of the individual. But however it is, if a temperament variation is there, definitely there will be corresponding brain chemistry. Therefore, we must know the dopamine, endorphin, dopamine, serotonin, then oxytocin, these types, or the cortisol or adrenaline. Each and every steps we know, then we can understand a mental rubric clearly. If you are prescribing a drug according to the physical general, mental generals, then PQRS, peculiar, cure, rare, and singular remedies. We can select the drug, or we can collect a similar drugs. We can collect the remedies within the repertoire of us, because there are enough conditions you can observe in the repertoire. Inflammation, mucous membrane, increased mucus secretion, induration, ulceration, glands. Why we are not combining it? Suppose if a patient who comes to you with liver trouble or hepatitis, if you are taking the inflammation rubrics plus the liver organ, or what are all the remedies that which are influencing upon this inflammation, and if among them, if you are selecting the drugs which are so suitable to liver, definitely that may be useful for hepatitis. Likewise, in almost all organs, we can use that. Clear? Yes or no? Clear. If any doubt
Yes, sir.
like that, that means, for example, a patient, if any patient who comes to you, you must know the normal patient, normal condition of it. Normal means those who know the normals are only the person who can understand the abnormal or subnormal situations. For understanding this abnormal or subnormal situation, we must learn this normal condition. That therefore, I am just giving stress upon this anatomy, physiology, then the pathology. The pathology is only in the disease condition, whereas the anatomy is the structure alone. Definitely, whenever a disease is going deeper and deeper, the structural variation will come. That means the functional system may convert it into a indurated stage, and after that it is going to ulcerated stage, as in the case that is SORA, psychotic and syphilitic. In between the psychosis and syphilitic, our tubercular things also seen. Therefore, the glandular involvement, then the endocrine system, the nervous system, and almost all parts we must clear. Then only we will be able to understand a patient. Those who are treating a patient without understanding the patient, definitely it is very less. Only after understanding the patient, we can go to the understand the medicine. Then understand the patients, understand the medicine, and constitute both. That is, we must understand. How we can understand the medicine? Medicine we can understand by using the kingdom characteristics, or by the source related, or by the pathophysiological action of each and every, or a toxicological effect of the drug. These are all being. Definitely, we must go through these pathophysiological conditions which are related to the materia medica, that is, which are related to each drug. Each drug has its own level of action. Whatever be that is, we are using the physiological dose up to 12, and after that, the dynamic dose will come. The dynamic dose means that is the 30, etc. Even that, definitely, whatever be the occurrence, definitely there will be an invisible background. That means dynamic stage. Only after that it will come to a portal, because a molecule is the most smallest particle is atom. Atom cannot be splitted further. But before the occurrence of this atom, definitely the proton, neutrons, etc. Anyway, that we have to go besides it. This is the thing why we have to understand. Nidheesh, കുറച്ചു നേരം continue ചെയ്തോളൂ. And is there doubt? You can ask.
Yes, Prasad Pandey, sir, you can now.
Yes, sir.
Okay.
Sir,
Yes, sir.
I was listening sincerely the view of sir. Actually, sir, when the disease progress, but naturally it travels from function to structure, and accordingly the miasm change, that means from sora to syphilis. So in soric phase, what happens, the ectodermal layer is mostly affected because of the because the ectoderm, those organs which develop from ectoderm, they are more susceptible towards soric manifestation, and at that time what happens, the vital force remains active. Because of the activeness of the vital force, we are able to get the symptom precisely, and because of the activeness of the vital force. If it will not treated properly by antisoric medicine, then the disease progress and the psychotic miasm entered. So when the psychotic miasm entered, but naturally the vital force becomes passive during psychotic phase. Because of that, there is stagnation. Because of the passiveness, because of stagnation, the diseases which occurs because of the psychotic predominance, that is infiltrative and proliferative disorders, structural change starts there, and accordingly the mental symptoms also changes, as previous speaker was describing about different layer. So if you will not provide antipsychotic medicine like medorinum, nitric acid, whatever it may be, as per the symptomatology is concerned, then but naturally the next miasm, that is tubercular miasm, get entry. So during tubercular miasmatic phase, what happens, the vital force which role is to preserve this material body becomes active, and though there is the resource is poor. So at tubercular phase the resource is poor. Because of forceful motivation, what happens, the signs and symptom becomes more precise, and rather it seems like sora, but it is in heightened level. That's why tubercular miasm is called heightened sora or pseudo sora. So at that time the vital force is active and needs anti-tubercular medicine like tuberculum, like spongia, like phosphorus, etc., as per the totality concern. So if you will not prescribe the anti-tubercular medicine at that time, what happens, the disease again progress and the destruction starts, the syphilitic symptoms appears, again the vital force becomes passive. So everything has been written in the commentary of B.K. Sarkar. So in this way we have to consider seeing the layer which is affected and the symptomatology which we are getting, about the whether it is of more active, and about the structural change. If there is no structural change, we have to go for antisoric. If the symptoms are precise, then if there is structural change, it is up to proliferation and infiltration, then we have to go for psychotic, or then if it is progress, the reversible changes occurs up to tubercular phase, we have to give anti-tubercular medicine, or if it is progressing again, then the mesodermal layer is affecting and the diseases occurs in the organs which are developed from mesoderm, then we have to give antisyphilitic medicines. So these are the guidelines given by our stalwarts, as you are expressing. So the knowledge of anatomy, physiology and pathology is highly essential to treat the disease properly by considering the homeopathic principle. So these are essential, as you are stated. I am at one with your proposal, sir. Thank you very much. Am I correct, sir?
Yeah, definitely, absolutely. What you said is right. I just give another version of the same. That is in the Sora. That is the beginning, because the functional mechanism, functional defects. And the second is the function after that, the induration comes, etc. That means whenever you are any case that which is unbalanced in the functional states, that which comes under the category of Sora. And whenever that Sora advance to a limit, then we are having antisoric remedy. Before that, we can just give, no doubt. But I am not at all giving the treatment, but at the same time, that when an inflammation goes to a stage of induration, in between, sometimes we have to require the antisoric remedy. Whereas After that psychosis, it may convert into syphilitic. Before that, the tuberculosis will come. Therefore, the tuberculum may be needed. Then only everything. That is, these are the prescription style. What I said is, what are all the occurrences which has been taking? Now I want to convert our system not only in the symptomatic medium, simultaneously we have to go to this pathophysiological point of view. For example, suppose we are using the argenta metallicum. It is a metal. If we know the metallic property, if we are going through the metals have its own qualities and understanding. Definitely the symptoms which are related to that, definitely it is having similarities. But those who know a source related thing, definitely there will be something. Therefore, in order to understand, not only by understanding the symptoms alone, you have to go through. For example, suppose if a person who is suffering with a hepatitis, liver, but then we can understand that it is the liver is the organ. Then hepatobiliary system is in trouble. But the hepatobiliary system may be because of the metabolic process or metabolic disorders. But without understanding these metabolic happenings, how we can treat this hepatitis? Therefore, we must acquire knowledge from all areas. That is not only by the symptom alone, instead of which we have to go through the. Therefore, what I am saying to you that the totality of symptoms means uncommon, peculiar, characteristic symptom. Suppose if a patient comes to us, the presenting complaint. Presenting complaint means whenever he says a symptom, we must convert it into a complete symptom. That is location, sensation, modality, and concomitance, from which we are able to select a drug. But whenever we are selecting a drug according to location, sensation, modality, and concomitant, at the same time, we can inquire that which organ is involved. Why not? Is it trouble? No. Then which system? If we know the organ, then we must understand organs are different. Liver is a hard organ, whereas intestine is a hollow organ. Then what are the structures? What is the difference? Therefore, each medicine has its own sphere of action. Its action is on the particular organ or particular system. That also we must understand. Not only, I am saying only to doctors that please take the symptom along with which organ is evolved and the system is evolved. If we are understanding both one and the right and left side, definitely we can show miracles. This is what I said now. Therefore, what the previous doctor said, absolutely right. I taken the other version also. Clear?
Yes, sir. So it is an integrated approach of treatment. So we have having thorough knowledge about all the allied subject as well as homeopathic philosophy organon, and you have to correlate each things and consider each thing for selection remedy as you told. So this is the right way to select the remedy. And the young friend who was describing about the different layer, also that is a good concept, but need to understand the real philosophy of different layer, and accordingly we have to select our medicine. The concept is very good concept, sir.
Definitely, thank you. Well,
Yes.
I am saying to all junior doctors, because the technology has been developing. During the Hahnemann time, there is no such technology. Allopus, because those patients who comes to us, they are having much more knowledge than us. They will ask, what is my disease? How can it treat? And what steps you are going to take? These are the questions. Definitely, in the next eras, definitely the patient will ask to them. But if we
Okay, sir, we can
we must.
arrange another session.
Okay.
Our
I
time
think.
is. Yes, sir, this kind of discussion is very good, sir. Over to Dr. Ringel to conclude the session.
As we come towards the end of the today's enriching session, I would like to extend my heartfelt gratitude to our respected speaker, Dr. P. Nidheesh sir, for sharing his valuable knowledge, clinical experience, and insights on a structured approach to a clinical reasoning in homeopathy, part 3. A special and heartfelt thanks to Dr. Nidhi's respected father, sir, for your graciously joined and taking part in the today's discussion. Your presence and valuable contribution made the interactions more meaningful and special. I would also like to express my sincere gratitude to the entire IFPH team for their continuous efforts and dedication in conducting these uninterrupted daily webinars and creating a platform for learning and sharing the homeopathic knowledge across the globe. I sincerely thank to all the doctors, teachers, students, practitioners and participants who joined us today and made the session interactive and successful. I would also request everyone to subscribe to the IFPH YouTube channel IFPH Homeopathy, where recordings of the most of the previous webinars are available. Please like, share and subscribe the channel so that the valuable academic session can reach a wider homeopathic community. Once again, my sincere thanks to Dr. P NIDHEESH sir and his respected father, the entire IFPH team, and all the participants for making the 2082nd day of the IFPH uninterrupted daily webinar truly memorable. With this, we conclude today's session. Thank you, everyone. Keep learning. Thank you.
Okay.
Thank you. Thank you very much.
Yes, thank you, Dr. Ringal Atharwal, Dr. Radhakrishnan sir, Dr. Vibhu Prasad Pandey sir, Dr. Karunagar, and Dr. Nitish for an excellent hour session this evening. Thank you all. Tomorrow we will have a session from Dr. Paul Joseph from Canada, and Dr. will be talking about sciatica, a different case. Thank you all. Over to Dr. Mariamma John tomorrow in the Malayalam session.